Hi, Lynn. How are you doing today?
Doing pretty good. How are you?
I'm good. Thanks for asking. So I just kind of want to get started with some basic, just letting you know that I will be taking notes. So if I'm ever not looking at you, I'm just kind of writing down notes for my own purposes. And I want to let you know that I am a mandated reporter. So anything you do share, I have an obligation to report if there's any concerns, but I will bring those up to you. And I also want to let you know that there is confidentiality. So, anything that you do say will stay within my notes and between you and I.
Thank
All
you.
right. Do you have any questions before we get started?
Not that I can think of right now.
Perfect. All right. So, do you mind just telling me a little bit about what brought you in here today to see me?
Yeah, I've been I've been struggling a lot with stress and anxiety these past about I want to say 6 months. Um, Ever since I got into this pretty bad car accident about 6 months ago, I've just been having struggles with anxiety, struggles with sleep. I've been having a lot of nightmares and some flashbacks. I don't know. I just feel like I'm not really capable of happiness right now since like the car accident occurred. I've just been really out of it.
Okay. So it sounds like things kind of started around this 6 month time period surrounding your car accident.
Yeah, yeah.
Is there anything else that you can kind of tell me about, like, what does this stress and anxiety look like to you, and what does it feel like?
So a lot of times I've been overthinking a lot of intrusive thoughts, that I can't really control. And whenever I get that overwhelming thought, I just start feeling really nauseous physically. Sometimes I'll even throw up because of how much I'm just overthinking.
Mhm.
But yeah, that's kind of what's going on.
So overall, just like not feeling good, not feeling. Would you say that you're not feeling yourself in a lot of these moments?
Yeah.
Yeah, that can be super hard to manage and deal with.
Mhm.
Um, do you have anybody that you're able to identify, um, who you would say is like your support system or helps you kind of through this?
I would say I do have two pretty close friends of mine, that have been really supportive and just been there for me a little extra since the car accident occurred.
Yeah, that's really great that you can say that you have some friends who have been there for you.
Yeah.
It's nice to have someone to lean on sometimes.
Hmm.
So, kind of going back to this car accident and like what you've been feeling. Is there any like specific nightmares that, like, are they reoccurring? Are they different? What do these nightmares look like, if you're okay sharing?
Yeah, yeah. So a lot of these nightmares are recurring. It's just like the same dream over and over again. Um, it's just of when the car accident happened and like the few seconds right after, and just um, kind of like everything that happened during that car crash just keeps repeating, and I can't really get it
Okay.
out of my head.
Yeah. And I don't want to, assume anything. But you said that this is affecting your sleep. Is it that the nightmares are affecting your sleep? And like, how often would you say that you're having this like sleep disturbance?
I would say, yeah, every night. I've been going through it. I probably wake up 3 or 4 times at least from having the same nightmare over and over again.
Okay. And how do you feel like not getting enough sleep is has been affecting your day to day?
I just, I'm not, I can't be as concentrated as I used to be. I'm not as focused with things. I'm easily distracted. Um,
Okay.
and again, I'm not feeling like I'm capable of being happy anymore.
Okay. Um, yeah, so this it really sounds like you're going through a lot right now. And I'm
Mhm.
so happy that you have trusted me to kind of work through this with you. And it takes a lot to come in and be able to talk about this. So it I just wanted to acknowledge that you coming in and talk to me, this is a really big thing that you're doing. Um, so I want to get your feelings on, what do you feel like you could benefit the most from with working from me?
Um, I think kind of going over my nightmares, working on that, and just trying to deal with those overwhelming and overthinking those thoughts
Yeah.
could really help me. And just like, yeah, I think the main problem I'm having right now are those nightmares, and it's
Okay.
just been affecting my sleep and my overall.
Is there anything that you have tried to do so far up until this time within this past 6 months, let's say, that has maybe worked a little bit or you feel like has not worked at all?
So I have been uh, trying to do like a little self-care routine before I go to sleep and just try to like settle my mind down. So basically
Mhm.
with that, I've just been like getting off the electronics and kind of just doing some reading and something that I like to do, but it hasn't helped as much as I would like. Um,
Yeah.
yeah, because I'm still having these nightmares and waking up so often.
Yeah. So I want I want to kind of take you into this like moment here and just kind of bring you to the present and even ask you to look forward a little bit. And ideally, if you were to wake up one of these days and your problems were gone, what would that look like and how would you know that all of these problems are gone?
Um, it'd probably be me waking up with a full night's of sleep, not having any nightmares, and kind of going about my day without all this overthinking and intrusive thoughts just popping in my head. Um, and yeah, just getting
Yeah.
through daily activities, without any of that
Yeah.
extra stress.
I think, would you say that maybe this is kind of your goal of kind of working with me, is that you want to be able to wake up one of these days and not have this, constant like remembrance of that car accident?
Yeah, exactly. That is
Yeah.
my.
I think that's something really great that we can work on together. And um, I just want to make sure that I have kind of gotten a good overall picture of what brought you into me today. So I'm just gonna do a little bit of a reflection and like paraphrasing of what you kind of talked to me about. And I want you to tell me yes or no if I've kind of got it and I got the overall understanding, okay?
Okay.
So you talked about how you had a car accident 6 months ago. It has affected your like day to day with having these flashbacks. It has interrupted your sleep and you feel like you can't get a full night's of sleep.
Hmm.
You do have some support, which is your friends you were able to identify, but you still feel, from day to day, you can't really concentrate and that you're distracted. Would that kind of sum up everything that you like went through?
Yeah. Yeah, that sums
Okay,
up everything perfectly.
perfect. And then, we're kind of what your goal is and what what our goal is from working together is that we want to kind of manage the stress and anxiety around all of this that you feel. And ideally, you would like to be able to wake up with a full night's of sleep and be able to just go about your day without having to worry about
Yes.
anything from the past.
Yep.
Yeah.
Exactly.
I think I think this is a really great place to start.
Hmm.
And do you have any thoughts as to what you might be able to do until we meet next time? Like, do you have any thoughts or feelings about anything in your control?
Um, I'm just going to continue like leaning on my two close friends and um, just kind of asking them to continue to support me and be there for me during this time.
Yeah.
Yeah.
I think it's really great also that you are trying to utilize self-care because that is something that's so important to
Hmm.
being able to take off some of this feeling that you're going through. So I would definitely recommend, keep trying. It's not hasn't worked yet, but I would definitely support you in that.
Yeah, I'll keep trying with that.
Yeah. So I think this is a really good place to stop. Um, how about we plan to meet in about a week to kind of go over how we're going to achieve your goals and how maybe this past week has gone with you continuing to utilize your friends and your self-care.
Yeah, that sounds good.
All right. Does next week sound good?
Yeah,
All right. Well, thank you, Lynn, so much for meeting with me,
thank you.
and I will see you next week.
Okay, I'll see you then.